Hi, I'm Robyn Hyden, the Executive Director of Alabama Arise. I wanted to give a quick video update to a blog post I wrote about a month ago entitled 7 Policy Responses to Protect Alabamians from Coronavirus. A lot has happened in a month. It's been 1 month since we closed our office and went to working all remotely. And there's a lot that's happened at the federal and state level. So just want to give an overview of where things stand and where our advocacy efforts will focus over the coming months. First, I want to say Happy Easter to those who celebrate Easter. Happy Passover if you celebrate Passover. I know last weekend was rough, and for those of you who survived storm damage or tornadoes, I hope you're safe and well and protected. It's been a very long month, and we feel that our state and federal government have a long way to go in adequately addressing what we think may be the biggest economic crisis that any of us might ever see. So here's where we are on those 7 key issues. First, on healthcare, we have continually called upon our state to expand Medicaid. We're not going to stop because of this crisis. In fact, we're going to escalate because the need is more critical now than ever. We know that if we don't bring in every available federal dollar to shore up our healthcare infrastructure and to support our frontline health workers, we're going to be leaving people out in the cold who need support. We're going to be missing out on critical funds to address needs. We know that some of our most critical workers, like grocery store clerks, pharmacy workers, sanitation employees, or childcare workers, are uninsured. And this is wild that we would go without covering people when there is an available option that brings in 90% federal match to support health insurance for those populations. So we're going to continue to call on Governor Ivey and our lawmakers to expand Medicaid. We appreciate you all for joining us in that effort. If you're one of those people who's living and working without health insurance, whether that's because you've lost your employer-based insurance, you can't afford it, you're a caregiver, we want to hear from you, because those are the stories of real people that we think will change the dynamic here. Every community is impacted by a lack of health insurance. We believe our state has a critical opportunity to act, and we think now is the time for them to do that. So in terms of what we hope to see happen, we hope to see Congress increase the federal matching funds available, and we're going to advocate for that as a part of the next round of coronavirus response. But we also hope to see our lawmakers take the 90% federal match that's currently available and say now is the time to take that money and to infuse it into our economy, to get through this crisis and to make us stronger than we were before. Second key update is about public health funding. So I wrote about this a month ago. We have signed on to letters calling on our State Department of Public Health to extend testing to even more sites, and they have done so. But there's a critical infrastructure need that's lacking in rural communities and Black communities, and this goes well beyond just one department. This is systemic underfunding of state services. So as our lawmakers come back to the session, which they've indicated they would like to do at the end of April. We're not sure if that will happen, but if they are there, we're going to be calling on them to increase their investment in community services, including public health. We think that the federal government has a key role to play here, because in their bailout funding, we need to allocate more money for states. We believe that Alabama is set to get about $1.9 billion. That sounds like a lot of money, but it's not going to be enough when we look at the economic crisis that's coming. So we know more resources are needed, and public health is one of those critical needs that just highlights where more investment could make a big difference in saving lives. A third area of concern that we raised was about food assistance, and particularly around the SNAP program. So Congress has acted to expand the benefits that are available for currently eligible people. They've expanded eligibility somewhat, but there are still a lot of people who need help. We are glad that our Department of Human Resources have submitted a plan to extend SNAP benefits for the families of children who get free lunches. That will be a huge help over the coming month, and we are glad that's coming. But we still hope to see Congress expand SNAP benefits by at least 15% during their next round of legislation. Fourth area of concern for us is about unemployment insurance. So we are really glad about some of the changes that have been made at the federal level. There's more money available if you get unemployment. More people are eligible. So if you previously were ineligible because you were a gig worker or a contract employee or self-employed, you now can apply for unemployment insurance, and that is huge. But our state, unfortunately, limits benefits to 14 weeks. We know that's got to change. So as soon as our lawmakers come back into session, we expect them to act and extend those benefits well beyond 14 weeks. The federal government allows you to receive 39 weeks of benefits. That would be ideal. We know this is a long-term crisis and we need long-term, long-range solutions. Another area of concern for us is about paid family, sick, and medical leave. We were really pleased that the Families First Act, passed by Congress, extended paid family sick leave to millions of workers. However, there were still too many workers who were exempted from that coverage. So people who are considered essential workers still don't have access to that paid sick leave or paid child care leave. And we think that when Congress comes back to pass their next round of funding, they should address this problem. Another area that we've identified that we're really concerned about is how our state is responding to prisons and jails. We are really worried about the human rights crisis unfolding in jails and prisons. Too many people crowded into small spaces. It's not possible to contain the spread of an epidemic. So we are calling on our state to move forward with targeted releases of people who are incarcerated. We're a part of the Alabamians for Fair Justice Coalition, and you can read more about our call to action at alabamafairjustice.org. There are a lot of other areas for concern for us. We are really hoping that Congress will provide even more funding for families. The tax rebates that are coming out over the coming weeks, which max out at $1,200 per individual or $500 per child, are a good first step, but they're not enough given the scale of the crisis we're all facing. We're worried about renters. We're glad that the governor has temporarily suspended evictions, but we think that we're in for a huge housing crisis. We think utility companies, we're grateful they have temporarily suspended disconnections, but we feel there need to be more protections in place to ensure that families have access to water and power. So please stay tuned for more action alerts from us as we keep an eye on actions at Congress, opportunities to move forward at the state level. Just to know what resources are out there, this is evolving day by day. You can visit alarise.org and check out our evolving list of resources and updates on what's going on with coronavirus response. Click on Take Action to find our latest action alerts. Sign up for our daily news digest. Stay informed. Share those action alerts with your family and friends. Fill out your census if you haven't yet already. That's the #1 thing you can do to bring more resources to our communities right now. Thank you for being a supporter of Arise. If you are a member, we appreciate your membership. We appreciate your support, and we hope you take care and be well.